Good evening. Today is March 19th, 2018. I'm Nathan Johnson, the Contra Costa County Veterans Service Officer, and thank you for tuning in to Veterans Voices. Welcome to our 44th show, titled Real People, Real Care. Tonight, we will focus on getting to know the people behind the Veterans Healthcare Administration. I'm glad to be joined by my co-host, Kevin Graves, and who's a Gold Star father, and Calvet Link. Hey, Kevin.
Hey, good evening, Nathan.
Good to see you.
Good to see you, too. The purpose of Veterans Voices is to explore the issues that matter most to the veteran community and connect veterans and their families with resources and benefits.
Before we get started tonight, we want to acknowledge the tragedy at the Yountville Veterans Home. The three wonderful human beings that our community lost, Jennifer Gonzalez, Christine Loeber, and Jennifer Golick, dedicated their lives to serving veterans. This inexcusable act reminds us that, as veterans, we must hold ourselves accountable and seek help when we need it most.
If you're at home watching and want to join our discussion, please feel free to call us right now at 925-313-1170. Our phone lines are open, and we're excited to take your calls. You can also send us an email at veteransvoices@contracostatv.org or connect with us on Facebook at Veterans Voices 1.
We would also like to take a moment to recognize the service of Clayton McCrary. Clayton served in the Marine Corps from 2008 to 2013 as a machine gunner. He was stationed in Camp Lejeune and deployed to Afghanistan in 2009 with 2nd Battalion, 2nd Marines. Clayton lost two of his good friends by improvised explosive devices in Afghanistan, Eric Ward and Adam Peake, and he has dedicated his shadow box to his friends. We honor your fallen comrades with you, Clayton, and thank you for shipping your shadow box all the way from Tennessee.
Now I'd like to welcome David Stockwell to the show. Hey, David.
Hey.
Good to see you again.
Thank you.
Thanks for coming down. We appreciate it. Sure.
So, David, you're the Director of VA Northern California Healthcare System, and today we're pulling back the curtain to say a little bit about the purpose of the show is trying to talk to more of the people, the human beings that work at the VA. So you've been the director there for a couple of years now?
Yes, October of 2013, so coming up on 5 years.
But 5 years is a part of an overall much larger career. How long have you been with the VA?
30 years this year working for the VA, 7 different locations all over the country, so it's been quite an experience.
And previously you worked at Martinez before you were the director.
It's my second tour here. Right after they closed the hospital in the early 90s, I worked in Pleasant Hill and Martinez. Yep.
Well, welcome back. Glad to have you.
Thank you.
So, talking a little bit about the VA, tell us a little bit about what's happening here at Northern California Healthcare System today.
You know, it's an exciting time in the VA. We've been measuring how many veterans get care at the VA for 26 years. We're counting how many come and get health care. And this year, we set a record. Every year, we've broken our record from the year before of the total number of veterans we're providing care to. And so it's exciting that a greater number of veterans are getting their health care at the VA in Northern California.
I think that's a very relative number from the standpoint that the actual number of veterans is declining. And so that means that it has even more of an impact. More and more people are being connected with their benefits through our county veteran service officers who help them do that. And it's great that you guys can provide that care.
Yeah, the vet population is declining, but you know, with the expensive health care on the outside, you know, predominantly free care, no monthly premiums, high quality care, veterans are coming and getting care at the VA. And this year, 3% more than last year already, so we're still growing.
That's fantastic.
Yeah, I think I read that the Northern California Healthcare System is now the 12th largest VA healthcare system.
In terms of number of veterans served, that's true.
So tell me a little bit, how do you focus on quality? When you're serving more veterans, how do you maintain a healthcare system that still takes good care of our veterans?
One of the important things at the VA for healthcare is that we're not an insurance company. We're not making money as part of healthcare. A veteran is a veteran for life. You never unbecome a veteran. And so paying attention to the whole patient. So doing things like paying Benny Travel just to get them to their doctor appointment, or working with the homeless agencies to give a permanent home to a chronic vet. These are ways that we go above and beyond to provide quality care.
And who are some of the people that work at the VA every day? I know we're going to get to meet some of them. We have some of them as guests, but give us kind of a synopsis of the typical doctor or nurse or staff person at the VA?
You know, we just did our all-employee survey this year. One of the things that our staff said is it's more than a paycheck. And so people that come to work for the VA are often inspired. They have a family member. My son-in-law is on active duty right now in the United States Air Force.
Okay.
They're veterans themselves.
Yeah.
40% of our workforce are veterans. And so they've wore the uniform, and they're trying to continue to serve veterans to come alongside their colleagues, their former colleagues as well.
Good, very important. So I'm assuming the VA gives a preference then for veterans to come work there. Is there some type of hiring incentive, or is there some type of recruiting effort to bring more veterans on board?
Yeah, both happen actually. So a lot of people that so we have a joint venture with Travis Air Force Base, and you know, many people on active duty, they're serving veterans right alongside active duty beneficiaries, and many of those folks, when they take off the uniform, say, you know what, I know what it's like to serve veterans already. I'm going to continue my service and come to work for the VA. We do have hiring preference for veterans. In fact, every single housekeeper that you encounter at VA Northern California, 100% veteran workforce. They're all veterans.
Okay.
Wow.
Yeah.
Great.
Veterans, of course, can do other things other than housekeeping, which I think is important. Do you find that when veterans come who have done their job in the military, do their skills translate directly to working at the VA? A physician in the military, are they a very well-trained physician, maybe better trained than someone coming from another training environment?
You know, of course, you were in the military. You know, the military dedicates training resources, school, and so people that come through the military in their professional career as nurses, as doctors, not only are they more in tune with what particularly might ail a veteran because they've lived in that same environment, they're familiar with being deployed potentially and all the challenges that can come with that, but highly trained, high quality professionals. Yeah. We also recruit from academic affiliates. The VA trains more medical residents than any other healthcare system in the United States, and so people come, they see, hey, the VA is high quality care, and they decide to come work for us.
Do you think there's a certain amount of comfort that comes to the patient, the veteran patient that comes in knowing that they're dealing with a high percentage of veterans when they come through the doors?
I've had a lot of veterans write me a letter and thank people that are providing their care to them. But one of the reasons that veterans enjoy coming to the VA is they know that they're understood at a greater level. And so if their provider can appreciate what a reintegration after deployment is, or how difficult it might be to find a job after you've been on active duty for an extended period of time, and they can connect on that holistic level, veterans just enjoy and they feel more at home at the VA in that regard.
I want to talk about the future of the VA, but before we do real quickly, just peel back the onion here a little bit. Why do you do this? Why are you a healthcare director within the VA? Because I would assume that you could be a healthcare director anywhere, major hospital system in the nation somewhere else, but why do you work for the VA?
I mentioned the connection to mission more than a paycheck, and serving those that have served our country, it's a great reason to get up in the morning and to go to work, to think I'm not just out there making a living for my family or using the skills that I was educated for, but it has a purpose. And so many people, including myself, work for the VA healthcare system because we feel like we're not profit-driven, we're here for the patient, we're providing care, not trying to make money. And so it's a great place to practice healthcare or administer healthcare in my case.
Absolutely. We appreciate that you do that. So let's talk about the VA of the future then. I mean, this is 2018, but what will the VA look like 5 years from now? Or maybe even farther out?
Yeah, so modernizing the VA is one of the priorities of the current VA administration. So we're working on a more modern medical record that can more easily communicate with private sector medical records. That's important as people get care, oftentimes with community providers, with other healthcare institutions, being able to transfer electronic data. We're going to get into the texting world. They're about to release something called Vet Text, and you can text to change your appointment or cancel your appointment.
Really?
So I'm not sure that's the 22nd century, but 21st century we'll be able to do text messaging with patients.
Yeah, that'll work really well with our younger generation vets.
They're also creating some new apps for the doctors to be able to use with their patients, I understand.
Mobile apps already for patients to self-manage their care, to communicate with their provider, even a video on demand feature that'll allow a provider and a patient each on a smartphone to be able to speak directly to each other. Or veterans that live in rural areas, they might not have a computer. They can go to the Veteran Resource Center in their community. We're just striking a deal right now up in Trinity County, way up in the North State, with one of the veteran service officers there to be able to use the Veterans Center for veterans to come and get electronic or digital health care with the VA.
And I think that's going to be extremely important for those 100,000 or so veterans that live up in the rural counties where the coverage just isn't, it's just not feasible to provide direct coverage like that. So
Moving care closer to where the veteran lives. The old days of the giant hospital and all your care, you got to come to the VA. We're trying to get away from that, and we're getting out to where the veterans actually live.
fantastic.
Yeah. Well, I appreciate you being on the show, and thank you for joining us again. Appreciate all that you and your staff do every day. I know that we'll have other opportunities to talk to you in the future, and hope that you'll join us again. And thank you very much.
My pleasure. Thank you.
Please stay with us. We'll be right back after this quick message from the Contra Costa County Veteran Service Office.
Welcome back. And now we'd like to welcome as our guest Dr. Scott Carter. Welcome, Dr. Carter.
Thank you. Happy to be here.
So, Dr. Carter, first time on the show, but we know each other. You work just across the freeway, and what's your role there at the clinic?
So I'm a primary care physician. So I work in the primary care. I also work for the multidisciplinary traumatic brain injury team. And also I'm a supervisor for primary care as well as urgent care.
Very important position. But you also served in the military. You're a veteran.
I was in the Army for 16 years. I went to the military medical school, USIS, if people are familiar, Uniformed Services University of Health Sciences, kind of a long name. But yeah, and then 16 years, lots of different assignments all over the place, and a deployment to Bosnia.
Oh, okay. I didn't know about the deployment to Bosnia. When were you in Bosnia?
2000.
Okay. Wow. Well, appreciate you being here tonight. Appreciate your service as well. When we're talking about real people and real care, and I want to mention to our audience again that you have the opportunity to call in and ask questions. If you can't call in, you can join us by Facebook. We're also on ContraCostaTV.org. We have a chat function there. You can email us as well. Join in the conversation. This is a rare opportunity to get to talk to the doctors and to the nurses who work at the VA. And so, Dr. Carter, what's it like to get up every morning, as David Stockwell mentioned, and to go serve veterans? What's it really like to wear that doctor white coat and to take care of our veterans?
Yeah, well, it's certainly a privilege. I mean, to take care of the veterans, that's a big reason why I am at the VA after being in the Army. Kind of continue after the active duty part and to continue helping veterans. And the VA is a great place to work as a doctor, in my opinion, because you can get what you need for the patient. If I need an X-ray, I can get it. If I need an MRI, I can get it. Labs, I can get it. If I need a specialist evaluation, I can get it. I don't have to fight with insurance companies usually or anything like that. So it's a simple system to help the patients.
And your whole career has been in the military. You never, did you ever have a private practice or work in a private practice?
Very briefly, I worked in some various urgent cares, but there was a short, about 8 months between separating from active duty until I came to the VA, yeah.
So you oversee a lot of doctors. What's it like for them every day? Do do they have a heavy caseload? Are they seeing a lot of patients in one day? And how much time do they generally get to see these veterans?
Right. So each primary care doctor has about 1,200 patients on their panel.
Wow.
And they get 30 minutes per patient. Generally at the VA, they're a little more complicated, the patients are, than outside the VA. Plus, we pack a lot more into the appointment. There's a lot of clinical reminders. We screen them for depression, for suicidality, for PTSD. We make sure they get all their immunizations, their cancer screening, colonoscopies, et cetera. So we pack a lot into the appointment. We make sure we spend plenty of time with them to get all the care that they need in that appointment.
Has an increased technology helped you to get through your appointments quicker so you can spend more just one-on-one? That's a lot of things to try, a lot of questions to ask and that type of thing. Has the technology that's been incorporated in the VA recently helped you get through that appointment quicker? I mean, get through the technical aspect of it
It's a
quicker.
little bit of a double-edged sword, because certainly it's wonderful. If I would need to get data, it's all there for me. It's all in the medical record. The VA is very good about putting it all in there so I can find what I need. However, the doctors have to input a fair amount of that data. So that's kind of the trade-off, is that it does take a little more time and a little more effort. But that's just now part of the appointment, so you just get used to it.
Yeah, I would imagine those are very important questions. And I think a lot of people rely on the VA to screen for those kind of things. I know that the focus of homelessness and the focus of suicide prevention are really looked at by the public as responsibilities of the VA. So do you feel like, as a doctor working for the VA, do you have to be more of an expert than just on general medical? Do you have to also be an expert on these other, I guess, subsidiary type issues that veterans?
Oh yeah,
face?
certainly. I think you have to become very good at the things that we see commonly. And so certainly the mental health issues, the depression, PTSD, traumatic brain injury, you get really good at doing that because you see a lot of it. You take care of a lot of patients with it. We also, I think, are very good with the geriatrics population, because we have had a high number of them from the Korea, Vietnam, World War II era veterans. So if you come into the VA, as an internal medicine or family practice doctor, and you've been taking care of, sort of a general panel of patients, you're going to really quickly get good at geriatrics because you see a lot of it also.
Now, I want to ask. We have a couple minutes left, but I want to ask, the events that happened in Yountville last week, if at all, how have those events shaped your role as a provider for veterans in a healthcare setting?
How has it shaped my role? Well, so I work in the traumatic brain injury building and work on that multidisciplinary team. So we actually take care of some of the pathway patients, and a lot of providers that I work with have had a close relationship with those providers. So it hit pretty close to home for all of us. So we've been sort of bonding together, kind of consoling one another and counseling one another. And then we've also been talking about safety and security and being aware of our surroundings. And but the main thing is to take care of the veterans and make sure that we're treating them for the stuff that's going on, the depression, the PTSD that can lead to problems if we don't take care of it.
We have an anonymous voicemail that came in. If a veteran is in good health, how often should they go to the VA for a checkup?
So that would depend on their age. If they're over 40, I would say definitely once a year. Probably most doctors would say even over 30, they should be seen once a year. The under 30 age group, you could probably argue that they could come in every 2 years. But all of our systems at the VA are pretty much set up for once a year, no matter what their age is, at a minimum.
Very good question. I appreciate whoever submitted that. Again, I want to invite you to participate in this conversation. We're talking with the doctors, with the nurses, the folks that work at the VA. Really, the most important part of the VA is the people that work there, not the programs, in my opinion. Dr. Carter, I want to ask you one final question. When a veteran doesn't know you, they just see their name and they know I'm here to see Dr. Carter, is it okay for them to ask questions about you? Is it okay for them to ask if you're a veteran, or where did you go to medical school? What's the best way for a veteran to really get to know their doctor in a way that goes beyond the conversation of just talking about their blood pressure or their diagnosis?
Sure, so that's a great question. Probably the first visit is not the best time to dig too deep into the doctor's background because like I said, we pack a lot into that appointment. So we're trying to get to know the patient and try to get their medical history and their medications and review their labs and find out what we need to do for them. So even that first visit is going to be hard for the doctor to get to know them very well. The second, third visit, then there'll be more opportunities for them to get to know us. Most of the doctors have things in their office that'll give a clue about their background. They may have their diploma up on the wall. If they're a veteran, they may have something there representing their military service. I personally have a collection of military hats that veterans have given me, so I have that up there, and so that's always a conversation starter for the veterans.
Well, as usual, our segments are way too short, but we thank you very much for being with us, for coming over, taking your time this evening to help us connect, or help our veterans connect with their healthcare system. So thank you very much for being here, Dr. Carter.
You're welcome.
Thank you.
Thank you for having me.
Before I welcome our next guest, we wanted to take a quick moment to tell you about next month's show. In April, we will be sitting down with the Veterans Benefits Administration to meet those responsible for making decisions about veterans benefits claims. We'll learn about who they are as people and discuss current issues. Welcome back to the County Veterans Service Office. Today, we're going to talk about the VA Healthcare Administration. The most important benefit that a veteran can take advantage of is to enroll in the VA Healthcare Administration VA healthcare system. Our office can assist a veteran in completing a very simple 1010 easy application for enrollment. For veterans who are eligible, once they're enrolled, they'll have access to the VA's comprehensive healthcare system, access to doctors, nurses, pharmacy services, and more. There's no cost to enroll. There's no monthly premium. There may only be a minimal copayment for veterans who receive care. So come into our office, let us help you understand whether or not you're eligible, and let us help you enroll in this very important VA benefit. Now, back to work.
Welcome back. And now we'd like to welcome Dr. Felisa Gaffney. Welcome to the show.
Thank you.
You have been here before.
I have. I was here a few years ago when I first started at the Vet Center.
Well, welcome back.
Yeah, you were on our episode that actually won an award. The topic was women veterans. So yeah, we're happy that you did such a great job. And thanks for coming
got us
back.
an award. Thank you for that.
Yeah, thanks for
Appreciate
that award. So you also work for the Vet Center as a psychologist and have served in the military. Tell us a little bit about your role in the military and at the Vet Center.
I was on active duty for 20 years. I served in aircraft maintenance scheduling and in bioenvironmental engineering. I actually came to the Vet Center from a prison. Working in the prison, I met some veterans there, and they felt like had they had help before, they may not have gone to that place. So that kind of inspired me to try to come back and give back.
I'm glad you didn't come there from prison.
Yeah, thank you for clarifying that.
I was confused about that, but so decades of service then, and we appreciate your service. What was the transition? Because it sounds like your job in the Air Force was very much different than your job now. So what was the transition like, and what really led you into that transition of caring for people?
So I was a senior in NCO. A lot of people told me a lot of things. Some of the things I wanted to know, some of the things I didn't want to know. But ultimately, that's what made me curious. And so I started looking into it after someone actually committed suicide, after I had spoken with them. I did everything I needed to do, but I felt very helpless. And I didn't ever want to experience that again. So I started taking classes, and that one thing led to another. So most of my education I got while on active duty. I went back after working in the field for a couple years and got my doctorate.
Okay. And did you know a lot about the Vet Center program when you started working there? Or, I mean, when I started working there in 2004, what Vet Center? I have no idea what this place was, but was it unfamiliar to you as well, or did you have some history with it?
It was pretty unfamiliar. I did know Jeff Jewell, the director of the Concord Vet Center, and I'd been in contact with him throughout my doctoral program just to see if I would be a good fit for the Vet Center program. After graduation and pre and postdoc, I came back to the Vet Center, and it was an actual good fit for me.
Well, we're glad you're there. It's a very important program. The Vet Center, not only in Concord, but nationwide, has been huge in helping out our combat veterans.
And let's talk just a little bit about that, for the difference between going to a vet center and going to a VA healthcare plan, and how you serve our veterans a little bit differently than they might get from over in Martinez.
So I serve combat veterans only and their families. I help them with readjustment issues. Sometimes it's a little more imaginative, so we have a little more freedom and autonomy to do different interventions, like who would think of a Marine playing in the sand tray? I did, and my veteran benefited from that, and he initially thought it was weird, but he got used to it, and he did very well after that. So I like the idea that if I can think of it, and there's a evidence base to it, I can use it at the vet center.
Do you think that being a veteran helps you connect with other veterans? And do they know that you're a veteran right away, or does that come out later on in their encounter with you?
I actually think that's one of the things I'm so proud of with the vet center, because we're all veterans who have served, and it's kind of my selling point for people who may be a little bit more resistant or think that I can't understand their point of view. Once I tell them I've served, and I served for 20 years and deployed twice, spent some time in prison, they're like, oh, you're cool, let's do it. So it's kind of my selling point.
What would you recommend to another veteran? If you just happen across them on the street, you're not Dr. Gaffney, psychologist, but having the insight that you have as a vet center counselor, a VA employee, what would you encourage another veteran?
Transitions are tough. Come in, check us out, see what we have to offer for you. Let's do the transition together. It was tough for me after 20 years.
Yeah, I appreciate that. I know that veterans are the best advocate for other veterans. I feel like if a veteran gets really served well by the vet center, they'll go out and they'll tell another veteran. And I think that's much more beneficial than any type of bulletin board or advertisement on TV. Do you think that you'll continue your career in the VA, and do you see yourself working up towards maybe a policy type position where you can make decisions on how the program reaches out to veterans, or do you want to stay where I'd say boots on ground, in no disrespect in any way, but boots on ground where you're helping directly face-to-face that veteran?
Right now, where I sit, I love the position I'm in, because I get to work with veterans every day, and I get to help them to make the transitions and the changes that they want to make, and help them to be productive in the civilian sector. So I'm really happy where I am now.
How easily do you work hand in hand with the healthcare part of? You work a lot with the psychological challenges. At what point do you interact with, like with Martinez or with the healthcare system in referrals and that type of thing?
So referrals we do are TBI, sleep apnea, just whatever's coming up for them. If there's maybe a medical cause, but it's manifesting in a psychological way, then we want to refer so that we can rule that out, so that we can make sure that they're getting exactly what it is they need.
But then you continue to care after that.
Absolutely.
They almost come to you for the primary care.
So we want to make sure whatever we do warm handoffs, because we don't want anyone to feel like they're not getting treated in a way that's humane. So I may call a doc while the person's sitting on the phone and talk to them during that time and help them to transition into that and continue to see them and follow up with them from that point.
And I think that's one of the biggest problems that I run into also in my work out there with veterans, is that they feel like nobody, like you're always being handed off to the next person. So I think that's an important thing to do.
Well, we have a chat question, but we're going to get to it in the next segment. This is probably not half the amount of time that we really need to talk to you, Dr. Gaffney, but thank you so much for being on the show tonight. Thank you for your service as well.
Thank you guys for having me again.
Thank you. Please stay with us. Next up, we'll be speaking with Kamara Fears, a supervisor of medical support assistant with the VA.
Just wait for Ron.
assume no unless we...
We are now here with Kamara Fears. Kamara, thank you for being here tonight. Welcome to the show.
Thank you for having me.
You work for the VA. You're a supervisory enrollment specialist. I may have gotten that title wrong, but you work at the Mather VA, but you're also a veteran. Tell us about your service.
Yes, I went into the military, into the Air Force Reserves first as a med tech and EMT, cross-trained to physical exams, then cross-trained to medical admin, had twins, had a little traumatic life change, and
certainly.
went into the Army Guard to be closer to the twins, and then cross-trained to the Air Guard,
Okay. So 20 years of service,
21 and a half.
21 and a half, and your husband served and retired from the military as well?
Yes,
Mom and dad as well?
yes.
Incredible. Whole family history of military service. We really honor your family. Thank you.
Thank you.
So you work for the VA in Sacramento, and we have a question from our audience. I want to see if you can address this question. You work for the VA, but what's it like when you hear other people talk about the VA? Maybe you hear the news talk about the VA. Maybe out on the street someone talks about the VA.
It makes me chuckle a little bit now because I know, I feel like I have the inside scoop. And so it gives me an opportunity to correct information that may not be correct.
Yeah.
And then it also, I feel like, helps me recruit. A lot of people I meet in different situations, once I find out they were previously in the military, the first thing I ask them, are you enrolled?
Yeah, right.
You know, and here's my card.
So there you are, the ambassador for
Right,
the VA, right?
Right. And then
Advocate.
also filing claims, have you filed a claim? Especially, I from experience this with my father, Vietnam veterans or veterans that have retired are a lot of times under the impression that they're not entitled to go to the VA because they retired, which is untrue. They do a lot better job now of briefing veterans before they get out versus in the past.
Yeah.
So my father didn't get the briefing
Right.
and everything of what you're entitled to, what you can do.
So what I'm hearing is you're not a doctor or a nurse, you're a supervisor, but what I'm hearing is you do a lot more than probably what's in your job description.
Yes.
And so I hear a lot of pride come from you in terms of your job at the VA. Do you find a lot of pride in your work? Does it feel good to go to work at the VA in the morning and help veterans?
Yes, it's a sense of accomplishment. A lot of things I do don't necessarily have to do with the VHA. We'll have someone, because they just hear the word VA. So they'll come in, their father or their parent or family member passed and they need a DD-214.
Yeah.
So we help them figure it out.
Great. I'm going to interrupt you because we have Wade calling in on the show, and Wade has a general comment about the VA. So Wade, are you there?
Yeah, I'm still here.
All right, Wade, thanks for joining us, and you have a comment about tonight's topic.
Yes, I just wanted to say thank you to Jeff Jules at the Outreach Center that put me in contact or in a group with Dr. Galsnik. And I wanted to thank them very much for all their hard work and the way that they've helped us and put us towards the VA in Martinez and the way that the people there have treated us with the utmost respect. And I was a sergeant in Vietnam, and I found out that after my wife passed, I needed help, and everybody has been very professional and given me all the help that I've needed. Counseling, group sessions, and also the VA up in Martinez have all been really great.
Well, Wade, thanks so much for calling in the show. We really appreciate that kind of feedback. I don't imagine that the VA gets that kind of feedback a whole lot. And I would imagine, Wade, that although you're the only one that's called in so far on the show, I would imagine a lot of veterans feel just like you do. So thank you so much. And I'm a patient. I really appreciate the VA. And I know that the VA works really hard. How does that feel to get a comment from someone like Wade to say thank you for what you do?
Very humbling, actually. I don't think any of us do it for the thanks. It's more to serve and to give back. I personally have never deployed, so I felt a sense of obligation to my brothers and sisters to serve them that did deploy.
Yeah.
And also their families. So it's very humbling to hear.
I think it's great. And I want to encourage other people who are watching the show tonight to call in with a question or comment. We have folks from the VA here tonight. I want to peel back the onion a little bit more, though. And when a veteran's not happy, okay, when a veteran has not had a good experience, and not that that happens a lot, okay, what do you do as a veteran, as a VA employee who cares about veterans? What do you do to handle that situation, help that veteran?
Usually I give a little bit of my background and try to get to the root of the problem and find out what exactly the veteran wants accomplished.
Okay.
And then, regardless of what department or what it has to deal with, we let them know we're going to help you see it through, or we're going to get you to the right person that's going to help you. You know, so don't get discouraged. We're going to figure it out.
You encourage them, you side with them, you share yourself with them, help them understand that you're also a veteran.
Right. And then if you need to come back, come back.
Yeah.
If you didn't get it figured out, come back. We'll keep looking.
Yeah.
Well, Kamar, we want to thank you very much for being on the show with us tonight. It's great hearing the insight from your position, and I want to also thank you for your service and for your time.
Thank you.
Yeah, and thank your family as well. Incredible.
you.
40 years or so of service in the military. Please stay with us. Next up, we'll be speaking with Daniel Davidson, a nurse at the VA hospital right here in Martinez, California. We're now here with Daniel Davidson. Daniel, welcome to the show.
Thank you.
Good evening. Good to have you.
Thanks.
Tell us a little bit about your military career.
Well, I started off right out of high school. I joined the Army. I was a medic. I was in the 1st Cavalry Division. I went to Iraq a couple times. After active duty, I got out and went to the National Guard. I was fortunate enough to be able to go to Hurricane Katrina and do search and rescue. So I've had a lot of very invaluable experiences through the military. And when I decided to get out, I was very confused. I didn't know what to do. So after piddling around in a few odd jobs, I decided to be a nurse. Might as well put my medical training to use. And 5 years later, I was a nurse, and here I am at the VA, and it's great.
I think you're the first guest to be on the set in a pair of scrubs. So I can tell that
Work attire.
Not only are you representing nurses and VA clinical staff, but you probably just got off work today, right?
I did. Yes.
So take us. In fact, you're still at work because here you are talking about the VA, right? Take us through the day to day. We want to know what a nurse goes through. We know you work very hard, but with respecting patient confidentiality, tell us what you did today to help veterans.
Today, well, I work in urgent care currently in Martinez. Today I was the triage nurse, so everybody that comes through urgent care gets triaged to determine their acuity level. We try and determine what your most pressing needs are and whether they need a higher level of care or not. being, do they need to see the doctor right away within 10 minutes? Do they need to, can they wait a little longer? Is it just a cold? Or do they need to go to the hospital immediately? And do we need to provide a lot of interventions? So, but it's really good. In triage, I like the opportunity that you get. You only get about 10 minutes per patient when you're triaging, but you get to connect. You know, there's a lot of veterans out there that have very good sense of humor, and it keeps triage very entertaining.
Well, that's a good way to look at it.
Yeah.
Makes the job interesting.
Absolutely.
I want to interrupt because we have a caller, but I need the name of the caller again. We have a caller from Tricia. We have Tricia from Concord. Tricia, thanks for joining us.
Thank you. Is this Nathan?
Yes, this is Nathan, absolutely, and Kevin and Daniel.
Hi, Nathan. This is Trisha and Truman, and I'm a significant other that has, myself and my family have benefited from the Vet Center. I want to thank Jeff Jewell for
A lot of love for Jeff tonight.
allowing them to have programs on for the wives. And I'm in a group with Dr. G, and my husband goes to Dr. Carter. But I believe we're one of the few vet centers that do things for the wives, and the wives do help take care of the veterans as well. So we appreciate all the help that we've been given.
Well, Tricia, thank you so much for calling. And Jeff Jewell sure has gotten a lot of love tonight, but I think he deserves it.
Absolutely.
And also, you know, Doc G and Dr. Carter were also recognized. So thank you so much, Tricia, for calling in. And so, Daniel, I want to ask you, as a nurse, you know, when a veteran comes in, they're probably not feeling very well, and they're not able to articulate very well what's going on. How important is the family member? People like Tricia, who sometimes come with the veteran to the clinic, how important is that relationship with them, and how, as a nurse, do you connect with that family member so that they can help you to do your job?
Oh, it's invaluable. I mean, the goal is always to keep the veteran at the center of all your care. Mm-hmm. The family members play an integral role in that, you know, and I have so much respect for all these family members that take care of their loved ones at home, and it's not an easy role,
Right.
You know, it's very taxing, and it's up to us in the healthcare system to recognize that and to understand what they're going through on a daily basis.
I imagine there's many times when that's where you get the best information is from the caregiver as opposed to the veteran themselves, who may not communicate it as well or may not want to communicate it as well.
Absolutely.
Sometimes it's hard to see your own maladies as easy it is as easy it is for somebody else to see them.
So what would you say to another veteran who is looking for a career, and maybe they were a medic, or maybe they were a doctor, or maybe they have some type of admin type role, and what would you say to another veteran who's thinking about going to work for the VA, doing something like what you do every day?
I would say take the next step and go for it. It's a great career. It's it's a lot different. It's not the same. Yeah, when I was in the military, I had this notion that the VA was very militant and strict, but
Yeah, formations every morning,
right, you know,
shoes shine, uniform squared away. Yeah,
you got, and it's different, but it's good. It's a very good transition. You get to interact with people that know what you've been through, and you can relate on a much deeper level.
So
Go ahead.
I want to ask about, just real quickly, the tragedy in Yountville. I've asked, I think Doc Carter earlier, if at all, how has the tragedy in Yountville affected your role as a care provider at the Martinez Clinic?
It is so tragic. My best friend's mother, he's in the Marines right now. He's actually in Afghanistan. His mother actually works in Yountville, And the first thing I did was emailed him, and all his family emailed him, and you know, it's a very sad thing, and yeah, I don't know. I haven't seen a lot of it, you know, come through in urgent care, but I'm sure that a lot of the mental health providers and primary care providers are dealing with that on a daily basis.
All right.
Well, you know, it's interesting, the different guests we've had from different departments, from the director throughout to the entire service that we provide for veterans through the VA healthcare system. I sense so much pride in everything that you all do together to provide that whole circle of care to the veterans, and it's very, very great to hear that conveyed in an exciting way. You guys are excited about your job, and I just want to thank you for being on the show with us tonight and for sharing that with us.
Absolutely.
And wish you the best.
Yeah, my sister's a nurse, so I really respect nurses. I know how hard you guys work. You guys are very critical. So thank you, Daniel.
Thank you.
Next up, I had a chance to speak with Mike Crosby, a board member for the Pathway Home at the Veterans Home in Yountville, California, where 3 brave women were recently taken from us. Let's listen to what he had to say. Hi, this is Nathan Johnson from Veterans Voices. I'm joined today by Mike Crosby, who is a board member of the Pathway Home. Welcome, Mike. Thank you for joining us.
Thank you, and good afternoon.
Tell us a little bit about yourself, Mike.
Well, I'm a proud resident of Brentwood, California, here, retired Air Force, proudly served my country at the Pentagon and throughout. I did not serve combat, but I was involved in a number of classified programs, and just came to Brentwood from Southern California, found out about the Pathway through Rotary. Rotary's been raising money for the Pathway Home, and very proud to do that. I visited the campus. I was asked to become a member of the board. I've been on the board for about a year, and it's significant to talk about the name. The Pathway Home is the pathway home for veterans to recover from the injuries of combat.
Well, thank you, Mike. A very important organization. Appreciate your military service and your role on the board there. I want to talk and just acknowledge the recent tragedy that occurred last week, and we're very sorry for the loss of life that the Pathway Home has experienced. And if we can talk a little bit about that and share with our audience some of the experiences and some of what the Pathway Home has been working towards. I'd first like to ask you, can you tell us about the efforts that are going on now to care for the veterans who are current Pathway Home residents?
Absolutely. The day after the tragedy, the board sprang together with the Veterans Administration, and we were successful in relocating the veterans to a place where they could continue to receive service. And we're keeping them together right now because they were a family. They were a small family, but a family. And as our chairman of the board has said, they've lost their mother. And Christine was their mom, and collectively among those 3 women, and they're young men, and they've lost the connection. So it's so important for us to help them maintain their growth. They're also enrolled at the Napa Valley College, so we're continuing to have them enroll as students and monitor their health with great psychiatric care if necessary.
Yeah, I think that's very important. I'm glad you pointed that out. We've always looked at them as the psychologists, as the director, but maybe overlooked the specific role that those women had within a familial type role, who they were within their tight circle, as you mentioned, the mother. And of course, the tragedy being that 3 women who were employees of Pathway Home were killed last Friday. Can you tell us about who these 3 women are or were, and what other things you might learn about their past service at the Pathway Home?
Absolutely. The Pathway Home will celebrate its 10th anniversary this year. And we stood down about a year and a half ago now when we retooled the program. And we retooled the program to do a couple of things. We made it longer, and we also struck up an alliance with Napa Valley College, and also a way to help them find a job. That doesn't mean what we did before didn't count, but we wanted to do a 2.0, if you will. So Christine Loeber was recruited. She had worked with the Santa Cruz VA. She had worked with the San Francisco VA, and she is such a spark. She was such a spark of energy. It's been reported, and it's true, that she seemed to have boundless energy. Because we were 724, she would sometimes sleep in her office on a cot just so she could provide coverage to these guys.
Wow,
And the
incredible.
Pathway Home is a live-in facility. It's just not someplace you come for the day. So there are food facilities, laundry facilities. Each one of our men were in a private room. So we did everything we could. So Christine was great. And our clinical director, Jennifer, both Jens or Jennifer, were just, you know, I'm at a loss of words because the biographies have been out there. What I can tell you is that when you met all three of them, you knew they cared. There are lots of opportunities to do a lot of things. One of these, Christine, was actually 12 years ago involved with the animal shelter in the Napa area. So there's been a long history of caregiving by all three women.
That's very important, and thank you for sharing that. I don't think we learn those kind of details from the media. And you know, you mentioned the history of the program. I remember when the Pathway Home opened. In fact, I remember even before it opened and the discussion about how important a program was for our veterans who were dealing with transitional stress. And you mentioned that they cared, and I think the community cares a lot about the Pathway Home, and they care about its future. Can you tell us a little bit about what the future of the Pathway Home will be?
Absolutely, absolutely, and thank you for asking. Right now, it's only 7 days since the tragedy. And our focus right at this moment, in fact, I understand this program we're having right now will be aired at that same time as a celebration of life that's occurring Monday night. We're gearing up for that, and that will take place then, and our next step is actually the long term. I can tell you that we have individual donors that have stepped up, companies who have stepped up, government agencies. The VA has been marvelous. Wow, what a partner in VA. And then we have a very, very visionary philanthropists who want to help. And so we know we need the following. We need facilities, we need funding, we need the service capability, we need the staffing. And when we can pull all four of those things together, then we can start to recruit our veterans to come back into the program. I can't tell you at this point how big the program will be. Currently, we are licensed at the Madison Hall on the campus for 34 veterans. We have the capability to go expand beyond that in that building. But I can't tell you right now whether or not we're going to return to that building or to the campus. That is to be determined.
Very important to know, and you know, I know that some of the information out there being reported in the media has not been accurate on that. So really appreciate you clarifying that the Pathway Home will have a future, and we will all look to support that. And speaking of support, and you mentioned partnerships and how important partnerships like with the VA have been, how can the community be a partner with the Pathway Home during this very important time? How can the community directly support the efforts not only to honor the loss of life, but to continue the mission of serving our veterans?
If you'd be kind to, and thank you for asking that, if you'd be kind enough at the end of this program to put up the website for the Pathway Home. There is a place there where people can donate funds. There's also been a special fund set up for the families of the three victims. And so those funds flow through the Pathway Home, and they go directly to those families. And that's all we can do right now. You can go onto the website. You can communicate to us. You can communicate to me as a board member here in Contra Costa County. They can communicate to you, and I'm sure you can channel it through. Right now, there are so many forces at play to guarantee that the Pathway Home will come around. And I would tell you, my phrase personally is now more than ever. Now more than ever for our veterans.
Absolutely. You know, I really do appreciate, I know that all of the work, you mentioned it's only been 7 days, and I know that there's been a lot of work done by the Pathway Home Board, by the staff, by the community there at Yountville, by California Department of Veterans Affairs. I know you guys have probably had very little sleep and certainly no personal time.
Do I look like it?
Yeah, and This will air after the Memorial Day, after the Memorial Service, excuse me, for these 3 women. But I do hope that memorial service pays, appropriate respect to the loss of life. And on behalf of the veterans and the community of Contra Costa County, we're deeply sorry for what has happened there at Pathway Home. And thank you so much, Mike, for joining us today. We have about a minute. Is there anything that we haven't covered that you'd like to share with?
I'd like to. It's really important for us to know that it's okay to grieve. It's okay to be sad for this. It's hard. It hurts. But we have got to do everything we can in our country, in our community, to take care of those veterans who have some sort of moral injury as a result of serving. And moral injury is a larger term to discuss. I'm not a psychologist, but I can tell you that is so critical that we help them. And there are many ways to do that through using a great channel to direct them to get service. It's pretty simple. We can't allow this to continue to happen. And the only way to do that is to help our veterans recover.
Thank you so much. Again, Mike Crosby, U.S. Air Force veteran and member of the board of the Pathway Home. Thank you, Mike.
Thank you for the time today.
Well, we hope you enjoyed our show this evening. Before we go, we want to direct you to a few resources and events. The Contra Costa County Veterans Service Office is available to support veterans and their families in obtaining benefits from the VA. Please visit their office at 10 Douglas Drive in Martinez or call 925-313-1481. Learn more about VA healthcare at va.gov/health, or for those that are local, visit northerncalifornia.va.gov. FedsHireVets.gov is a partnership with the Department of Defense, Labor, Veterans Affairs, Homeland Security, and other federal agencies. Their website is the preeminent source for federal employment information for veterans. USAJobs.gov connects job seekers with federal employment opportunities like the VA across the United States and around the world. Are you a veteran who would like an opportunity for your voice to be heard? Do you have poetry, a story, or a piece of art that you want to share with the world? If so, our program wants to support you in the process by inviting you onto our A Vet's Voice segment. Please connect with our show by emailing veteransvoices@ContraCostaTV.org.
To rewatch tonight's episode, check back on our homepage later this week or check your cable provider's schedule for rebroadcast times. Our next live broadcast will be Monday, April 18th at 7 p.m. Be sure to tune in. Tonight's show is dedicated in honor of the victims of Pathway Home in Yountville, California. This is Veterans Voices of Contra Costa County signing off with a moment of silence.